Hello, this is Dr. David Green, Education Director for Premier Pain Specialist. Today's topic is what you need to know about trigger point injections. A trigger point is a tender and painful area of muscle. It's a hyper-irritable spot in the muscle that's associated with a palpable nodule in the taut bands of muscle fibers. Trigger points can manifest as tension headaches, tinnitus, TMJ pain, could be decreased range of motion in your legs, low back pain, a plethora of different types of symptoms depending on where the trigger point is. Palpation of the trigger point in question will elicit pain directly over the affected area and may cause radiation of it as well. The trigger point injection is outpatient. It's given into the trigger point. It may consist of dry needling, which is basically a needle by itself with no medication. It may have some numbing medicine and also possibly some steroid. Pain management doctors don't need image guidance for these. It's a very superficial area. The needle doesn't go very deep. Well, what does the injection help? One is myofascial pain, which is defined as chronic pain in muscle tissue. Those with fibromyalgia, tension headaches, tinnitus, TMJ pain, and low back spasms. It's an outpatient procedure. As I mentioned, no image guidance is necessary. The needle is placed directly into the muscular area of tightness. Usually a small twitch is seen and sometimes felt as well. As mentioned, you may not need medication. The needle itself has been shown to often relieve pain, and the pain doctor can move it in and out of the affected area, and it can be repeated as necessary every few weeks. The results are often excellent for relieving the pain due to trigger points with the spasms and pain. It may need to be repeated every few weeks. There's no large-scale studies looking at these. The great news is that they are often effective with no medication at all. It's a very low-risk procedure with typically a high benefit. There's minimal risk. The needle's not put very deep. The biggest risk is that it may not work. There's a slight risk of infection or an allergic reaction if medication is used. If steroid is used too often, it can absorb some fat and leave a skin indentation. The top pain management doctors in the greater Chicago area are Premier Pain Specialists. They have 8 clinics currently throughout Illinois, accepting over 50 insurances and providing over 25 treatment options with the board-certified, fellowship-trained, award-winning doctors. Visit us today online at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you very much.